Oftentimes contentious Capitol hearing on the issue of Ebola. Joining us now, two congresswomen who were there as part of the House Committee on Energy and Commerce. Colorado Democrat Diana DeGette, who's the ranking Democrat on the committee. Also joining us, the Tennessee Republican Marsha Blackburn. To both of you, thanks very much for joining us. Congresswoman
Thanks.
Blackburn, first to you. What's your reaction to the president's decision to name Ron Klain as the new Ebola czar?
Well, they needed one person to be in charge of coordination, but I'm one of those. I would have loved to have seen someone like former Senator Bill Frist, who understands the medical and the governmental components, or General Honore, who did such a fine job after Katrina.
General Russell Honore, who was
Yes.
involved in Katrina. Bill Frist was the former Senate Majority Leader, who himself is he's a physician, he's a surgeon, he's a heart-lung transplant surgeon. What's your reaction, Congresswoman DeGette?
Well, I agree with Marsha that it's good to have somebody who can coordinate both the medical and the political and communication here. Ron has done this a lot. I have a lot of faith in our CDC and our NIH medical personnel. I think that they're handling these things according to protocols, but I think it's good to have somebody to coordinate that. So I think it's good that the White House has done this.
Because Congresswoman DeGette, you asked some pretty pointed, tough questions at that hearing yesterday. It sounded to me like you weren't completely satisfied with all the answers you got.
Well, I think that when Mr. Duncan presented himself at the hospital in Dallas, the way
he's the Liberian individual who had Ebola.
He's the man who sadly has died now. And when he first presented himself, I thought the hospital handled this very poorly. And then I think that subsequent to that, some of the NIH directives were either not clear enough, or else the hospital was not interpreting them clearly. And I think what we need to realize, and I'm sure Marsha would agree with me on this, is we shouldn't get hysterical over this. Ebola is not like the flu. It can't be transmitted by airborne transmission. But on the other hand, we need to have very clear guidelines about what we're going to do to handle these very few cases of people who have come into close contact with the bodily fluids of the sick people. And then we need to treat those folks and get them better. And we need to focus on eliminating Ebola in West Africa. That's where we need to put our efforts.
But you mean you weren't happy, not with the NIH so much as the CDC, the Centers for Disease Control and Prevention, right, Congresswoman DeGette?
That's right.
Yeah, I just want to make sure that you're not critical.
I'm sorry if I said NIH. I meant,
yeah, you said NIH, but I knew you meant CDC. What about you? Were you satisfied?
No, I was not. I think that there has been a lack of clarity and great confusion coming from the CDC. There was underestimation. The hospitals across the country did not have and still do not have clear, precise guidance. There is lack of coordination on waste disposal and so many different areas. The protocols, being more precise in these protocols, are something that we want to see. And as you've heard, there's unanimous agreement in this. We want them, we're here to work with them to protect Americans.
Are the hospitals in your district in Tennessee ready? If somebody walks into the emergency room with Ebola, will they have the equipment, the gear, all the expertise that they need to get the job done?
We would hope that hospitals across the country.
I know we hope, but are they ready?
We would hope. That is something that we don't know. And this is something where the CDC should be more aggressive in coordinating that effort, to be certain that every hospital has the gear that is necessary and knows what to do, rather than just say call the state health department.
We've heard these horror stories out of that Dallas hospital. They didn't have the proper gear.
Or how to dispose of the waste once they got it.
And as a result, two nurses now are suffering from Ebola. I want both of you, Congresswomen, please stay with us. We have a lot more questions, a lot more to discuss for our international viewers. A separate program, Leading Women, is up next for our viewers here in the United States and North America. We're going to talk about the proposed Ebola travel bans, mandatory quarantines, the effort to try to protect U.S. military personnel now being deployed to West Africa. Stay with us.
What kind of person is appropriate to fill this role? The fact of the matter is, this is much broader than just a medical response. The response that you've seen from the administration is a whole of government response to ensure we're leveraging the necessary resources to protect the American public. So as I mentioned earlier, USAID and the Department of Defense, in addition to CDC, have been involved in responding to the outbreak in West Africa. You've seen the Department of Homeland Security and Customs and Border Patrol play their important role in this effort, which is to monitor our borders and screen passengers from airplanes who are entering the country. There are additional screening measures that the Department of Homeland Security put in place just within the last couple of weeks to make sure that we're protecting the American public. There's an important role to communicate with state and local leaders, including public health officials, to protect the American public. There is a significant medical component here as well, of course, but it's not solely a medical response. That's why somebody with Mr. Klain's credentials, somebody that has strong management experience, both inside government but also in the private sector, he's somebody that has strong relationships with members of Congress, and obviously strong relationships with those of us who worked with him here at the White House earlier in the administration. All of that means that he is the right person for the job, and he is the right person to make sure that we are integrating the interagency response to this significant challenge.
The White House Press Secretary Josh Earnest effectively announcing that Ron Klain will be the new so-called Ebola czar. Ron Klain, a former chief of staff to the Vice President Joe Biden. Let's bring back Congresswoman Marsha Blackburn, as well as Congresswoman Diana DeGette to discuss what's going on. I want to ask you, Congresswoman DeGette, about this proposal for a travel ban that the United States should basically prevent people from those West African nations from coming to the United States, at least during this crisis, to which you say, Congresswoman DeGette?
I'm sorry, I didn't hear the second half of what you...
Do you support a travel ban on people coming to the United States from Liberia, Guinea, Sierra Leone, the so-called hot zone where Ebola really is focused?
Well, I think that if a travel ban serves a medical purpose, we should certainly consider it. But Americans shouldn't fool themselves that simply by making a travel ban it will make them safe. The World Health Organization estimates that if we don't deal with Ebola in these countries, we could have up to 1.2 million cases in the coming months in those areas. There's no travel ban on earth that will stop people from moving around the earth, and we will have Ebola in the United States. So it seems to me the top priority in West Africa needs to be to work as part of the international community to stop Ebola right there.
How do you feel, Congresswoman Blackburn, about a travel ban?
I think a travel ban right now would be a good thing. We have about 35 countries that have one. I've also supported having a quarantine there. If they're not going to do a travel ban, then we're having our military over. Let's set up something like a forward operating base, have people report 21 days before they're to leave the country, go into quarantine.
In those West African nations?
In those West African nations. And then on day 22, they're clear, they have no symptoms, they're allowed to fly. And I think that would go a long way to settling this situation and helping us get our hands around it so that we can manage our way through this.
Congresswoman DeGette, you know, a lot of people here in the United States, they're worried about what eventually will be probably 4,000 U.S. military personnel, including National Guard, reservists, the president signing papers to activate them, being deployed to those countries in West Africa. Are you worried about them?
Well, we need we need to realize Ebola is not transmissible if we follow appropriate protocols. And I assume that we're going to have strong protocols for those military personnel. We need to realize, I don't care if you're trying to quarantine people there, I don't quite know how that would work, but I don't care what you're doing. If we, as a part of an international community, don't stop Ebola in West Africa, it will be coming here no matter what we do. I admire those troops for going there and doing that, I've got to say.
Well, obviously they're very courageous, and we hope they all come back safe and sound. I know their families are deeply worried. You have a base, Fort Campbell,
yes, I do.
In Kentucky, where there's a whole bunch of people heading over there to Liberia, right?
I've got about 700 constituents that are heading over, and I can assure you, being in touch with the command team on post, talking with some of the families, people are very concerned. They want to make certain that our troops will not be in contact with people that have Ebola, that have been exposed to Ebola, that are in a control group, a surveillance group, and they also want to know how those troops are going to be handled if someone does contract Ebola, what the expectations are. So we're watching this closely.
As we all should. Congresswoman Blackburn, thanks very much for joining us. Good luck to all your constituents. Good luck to all the men and women who are heading over there. I know they're going to be doing critically important work. And Congresswoman DeGette, thanks to you as well. We'll continue our discussions down the road.